colleague from Louisiana to yield time to him at this point.
Great. Well, thank you to my friend and fellow physician and colleague, Dr. Gingrey. You know, you made reference to the 30-something Democrats, and I watched that debate, that discussion, with great interest because, to be honest with you, with the 32 years of medical practice and also owning businesses for nearly as long, when I hear this discussion about how a public plan can work, I really try to view that and try to understand that, but I always come out totally mystified with how this sort of thing could ever work. And to clarify the debate, basically Congress right now is looking at three different options. One is a total single-payer nationalized health care system, Medicare for all. One would be a private system for all, which is what we on the Republican side back. And then the other is a public and private system that are competing with one another. And so I really watch with great interest with our colleagues on the other side, none of whom are physicians, I might add, talk about how this could be a great deal, a great success, where you have a public system that's competing with a private system, and somehow that's going to drive costs and prices down, and we're going to get a dividend from that. Well, what I would do is point out to my colleagues, let's look at Medicare today and Medicaid as well, both government-run systems. Both of them are running out of money rapidly. The budgets are exploding and expanding, and they are living off the fat of the private system. Today, we know, in fact, a recent survey, a study came out showing that the average subscriber to private insurance spends an extra $1,000 a year to support the Medicare and Medicaid system. We also know that a lot of that support comes by way of the uninsured who are routed through the emergency room, who don't have any coverage. And if you think that the Medicare recipients pay for that, forget it, that's not happening. Who is paying for that is the taxpayer and those who subscribe to private plans. So right now, the systems that exist, Medicare and Medicaid, are for the most part supported not by premiums and not even fully by the taxpayers, but are supported by those who pay premiums into private plans. So if you expand Medicare to where everyone is eligible for a Medicare-type plan, who in their right mind is going to stay on private insurance when they know that they're going to have to pay increasing size premiums in order to get the same level of care that those on Medicare, who are largely supported by taxes, are going to get? And so what ends up happening is you lose that critical mass of those under private insurance, and so private insurance then becomes only an afterthought, a sliver of the economy. And so what you're left with is a giant public system, a Medicare that's much bigger than we have today. And incidentally, I'll remind those that today, as it stands, Medicare will run out of money within 10 years, as it is. It's unsustainable as it is. Now, if we grow it into a much bigger system, where are those cost savings going to come from? And so I'll yield back in a moment, but I just want to bring out the fact that no one has ever been able to show that a government-run system, healthcare system, but any government-run system in which the economy is being controlled in some way has ever controlled cost. And even today, we know that healthcare costs are going up twice the rate of inflation. And with that, I'll yield back and look forward to further discussion.